I was a fitness teacher, the step teacher. That's how I paid for part of my, my professional training, is I was the
Yep.
high-low kickboxing step teacher. So always have done a lot of cardiovascular work. Of course, I've also done a lot of weight training. So I've never really thought about my heart health per se, because I've always
The-
just had this baseline level of fitness that has sort of followed me through my life. But now that I'm in my 40s, and I think going through the pandemic really, and now seeing a much higher incidence of cardiovascular events. So even whether it's myocardial infarcts, it's spontaneous heart attacks, let's say, things like hypertension, cardiovascular disease. We start, in your book, I think that the quote that you opened up the book with is, if you're over the age of 10, the question isn't whether or not to eat healthy to prevent heart disease, it's whether or not you want to reverse the heart disease that you already have. And
yep.
it just hit me, as a 45-year-old who's starting to think a lot about things like VO2 max and peak heart rate and heart rate recovery and all of these different things. So maybe we can start by talking a little bit about some of the genetic contributors to cardiovascular health.
To understand the genetic insights, we have to sort of reframe what we think cardiovascular disease is. So most people think about the heart. And what we understand is that the heart keeps ticking until the last second, until you have that heart attack or whatever that episode is. It's the arteries around the heart that get calcified. They lose their elasticity. They get buildup of cholesterol and, the plaque buildup, right? That's where the disease happens. And so our research was focused on that. Let's deal with the actual root. And what we learned was genetically, we can determine the quality of hardware. So here's your artery, here's this tube, right? And the inner lining, the endothelium as it's called, we know what quality you have from your genetics. Is it stainless steel, resilient, or is it paper thin? So having said that, this is why we said it starts so early. Cardiovascular disease, 50% of North Americans are expected to have it. Why is this such a prolific number? Biggest killer in the world. I think 18 million people died last year of this
Men
one.
and women, ladies, it's not breast cancer, it's
Oh, yeah.
cardiovascular disease, biggest killer in women as well.
Yep. And from breast cancer, the biggest killer actually is cardiovascular disease. It's not the breast cancer itself. That's what women actually die from, right? So not all, but majority. So why is this so prolific, especially in women? So that inflammation that sets in here, right, in the endothelium, leads to cholesterol being used as a tool by your body, a hormone, to reduce the inflammation. That's why your body deploys cholesterol and sends it there. In the beginning, that's okay. In the beginning, that doesn't show up in blood work, no problem. It's something your body's supposed to do. Now, given many other genetic factors, how efficiently do you transport lipids, the ApoE gene? Do you do this job well? If not, then maybe it's going to not be processed at the optimal and stay behind, right? How toxic is your blood? Meaning free radical activity from that cardiovascular activity you're talking about. Somebody that's running on a treadmill doing HIIT exercise every day that doesn't have the best antioxidation genetics, the ability to deal with the oxidant that's produced by using oxygen as fuel, right? We all do that. How efficiently do we clear? That's the free radical that may cause the inflammation. Your cardiovascular activity may cause your cardiovascular disease, right? Your glutathione pathways, and how do you deal with the airborne toxins or the consumed gut toxins, or entering through your skin, or whatever it is that may be inflammatory in nature entering your body? How well do you clear? So you start to look at all these pieces and say, well, here's this hardware. I'm causing it inflammation by one of these many things, and I'm now using cholesterol to support that. When the cholesterol meets the free radical activity, itself gets oxidized and hardens, and then it starts to build up, and this wall builds up, right? So that's the point where you start seeing numbers appear in blood work, and you start taking a pill to reduce, suppress the, like a Lipitor, for example, number one prescribed medication in North America, to suppress this buildup, when that's not the disease. The disease is endothelium inflammation. And this is why it was so important to talk in the book about it starting early, because it takes a long, long, long time to get there. The other thing that happens, why does it manifest in your 50s usually? That's when your mitochondria falls off a cliff. So
And you've had 40 years of the disease incubating, right? It's
yes,
been incubating for 30, 40 years in the body. Yeah.
yeah, and you've gotten used to those habits, and you think that they're okay, because at that age, the body was resilient enough to deal with those habits. then your mitochondria falls off a cliff. The highest density of mitochondria in your body is the heart, the cardiovascular system. And all of a sudden you don't have the cellular resilience to fight back, right? There's this, front soldiers that were there already, push it away, and they're just not there anymore. And by the time you're 70 years old, you've lost 70% of your mitochondria, unless you're actively doing something to maintain, And so this is perfect storm that occurs. The environmental toxins, the food, the stress, everything is worse than ever before. And some people have bad hardware.